Let's stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Do we have any public comment? Seeing we have no public comment, we'll move on to the approval of the October 4th, 2023 Health and Human Services meeting minutes. Do I have a motion? Thank you. Supervisor Covelli, and with the motion, and second by Supervisor Krause. All those in favor, say aye.
Aye.
Those not, say aye. It is unanimous. All right, we're going to go on to policy issues, discussion, and potential committee determination. Number 5. Number 6, operational functions required by statute, ordinance, resolution, or policy. The 2024 85.21 Elderly and Disabled Transportation Grant Application. Beautiful. Thank you.
You're welcome. Good afternoon, everybody. I'm Dave Mack. I'm the planning manager with the county's CPZ department. Today I have in front of you in your packet for your review an application for funds that the county applies for from the State Department of Transportation to provide rides for our elderly and disabled transportation program. This is an annual application process. You may have seen this in the past. I've got the full application in the packet for you. I wasn't going to go through the whole thing because it is just, it's an application for grant funds. I can just explain a little bit more for you though. We are applying for, I forgot the number right away. We're going to be receiving $368,408. We need to come up with a 20% match for that. That's the $73,682. Those funds are already budgeted through the CPZ department budget for 2024. We do have 2 providers that we have that provide the rides for us. We go through North Central Healthcare. They have a transportation program there. We also go through Metro Ride in the city of Wausau. Metro Rides program provides rides just within the city limits of the city of Wausau, and the North Central Healthcare program provides rides throughout the whole county, even in the city of Wausau. So those are our 2 providers. As you see, if you go through the application, we split those funds that we receive by those 2 entities, and the CPZ department takes a little bit of money off for some of our salary and staff work that we do to maintain the Transportation Coordinating Committee, which is part of our structure here, that oversees this funding program and the rides that we provide to our elderly and disabled. Back, let's see, last week on the 28th of October, we held a public hearing for this application, which is part of the application process. Received no comments, which is usually typical. But we have gone through the process of the application to get it to the point where I can bring it to you today for your approval. We do have a resolution at the back of it. I think it's the last page of the part of the packet for you to consider for today. If you approve, then we will take it on to the county board for their approval and then submittal to the state DOT. Very short and sweet, but if you have any questions, I'd be more than happy to take them for you.
Supervisor Krause.
Thank you, Chair. I did notice an error. It's on page 13. It says paratransit fare is $2.25. It should be $2.50.
Yep.
So that's Project 2, passenger revenue. I just thought I'd bring that to your attention, could be a typo. It says 225 is the paratransit fare when it's 250. And I ride the paratransit, so I was thinking, am I overpaying them? Because it's 250 one way, and then the way back it would be another 250, so it's like $5 for a ride. But he said no. He said it's 250. So I just thought I'd mention it.
Good. I can make
Thank you.
that change in the application. Let me get that, when we can send that on to the state, we can make sure that that's correct.
Thank you. Are there any other questions? What are your wishes? Supervisor Cavelli.
Thank you, Madam Chair. Test. Thank you, Madam Chair. I'll make a motion to approve the elderly and disabled transportation grant application resolution.
Do we have a second?
Motion by Supervisor Gonring to second it.
Thank you, Supervisor Gonerine. So motion by Cavelli, second by Gonerine. Any questions? Seeing no questions, we can vote. Those in favor, say aye.
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 Those opposed, same. Okay, this is unanimous. This will be forwarded on. Thank you. Moving on to number 6, B, resolution supporting Senate Bill 328, healthcare price transparency. Gail, did you want to speak?
Please. Thank you, Madam Chair. I brought forth this resolution. I know that we all are consumers of healthcare, and being a good consumer means that you typically are able to see the prices of things before you buy them. However, in healthcare, that's not always the case. There is a bill before the Wisconsin legislature right now that would require shoppable services, things that are non-emergency, that there would be a searchable database with prices in it, so one might compare what those are. I know that as a county, our health insurance is going up faster than our net new construction, and I know other businesses are struggling to provide that valuable service to their employees. So Kelly, if you could bring up the graph that I had provided. And if it could be made just a little larger, thank you. This is price changes from 2000 to 2022. And while we know that prices have increased, inflation, hospital services is the top line. Below it is college tuition. Next is medical care services. So between college and medical care services are the fastest growing in inflation for our constituents. So if the Wisconsin Counties Association could weigh in on this, so that's what we're asking, is if Administrator Leonard could lend a submitting something to the Wisconsin Counties Association to lend their support for this piece of legislation. I'd also like to say that it is bipartisan. I looked up, the sponsors are both sides of the aisle, so I'd be happy to answer any questions.
Thank you. Are there any questions for Supervisor Marshall? Thank you. Supervisor Krause?
Thank you, Chair. Yes, I would just be interested in knowing who brought forth this suggested legislation. Was it a team of people or one or two?
You know, I just looked up the sponsors of the legislation and saw that it was from both sides of the aisle. I do not know the senator or representative who started it.
Thank you. Are there any other questions? Supervisor Cavelli.
I'll make a motion to adopt a resolution supporting 2023 Senate Bill 328.
Is there a second for this? Second by Donna Krause. Any questions?
I just have a comment.
Sure.
I think it's important that we have transparency in our healthcare system as well. And thank you, Supervisor Marshall, for bringing this forward. And I think with what we see on the graph up there and the rising costs, it's even more important now that people are able to budget for those costs. So that's why I'm supporting this resolution.
Thank you. Any other questions? Seeing none, let's vote. Those in favor say aye.
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 Opposed? Unanimously, it has passed. Okay, moving on to number 6C, discussion of Human Resources, Finance, and Property Committees 2024 proposed budget and possible recommendations regarding modifications. Any discussion on that? Okay. Seeing none, do we have a motion for this, for the budget?
Madam Chair.
Administrator Leonard?
Just procedurally, if I may, you don't need to take any action. This was just the opportunity again that you've had for quite a number of months. I apologize for the repetition, and I know HR Finance and Property Committee Chair Robinson is detained in another meeting right now, but it was just to allow for discussion. So there's no need for formal action. I apologize if we agendized that in a way that was confusing.
Okay, thank you. Moving on to number 7, educational presentations and committee discussion. A, update regarding residential facility services for the developmentally disabled population, and WASA Adult Day Services from North Central Healthcare.
All right, that will be me.
Gary.
All right, thank you. I wanted to take this opportunity to give the committee an update on some changes that we're making at North Central Healthcare. I think the easiest way to do this is to give you just a short history lesson. So I'm going to start with the fact that family care around 2010 is when a lot of family care ended up rolling out across the state to many of the counties. And when family care rolled out, the developmentally disabled programs were transitioned at that point from counties to the private sector. So as they did that, for reasons unknown, North Central Healthcare kept those programs. So we were one of the only county organizations that kept those programs. Well, in an effort for us to really concentrate on what we do best and what we're supposed to do, which is to handle the 3 counties' community programs, the mental health AODA programs, and then the nursing home, we looked at finding partner to transitioning these programs to, because we were actually in competition with the private sector with these. Actually, Opportunity Inc.'s old executive director had asked Lance at one point why we were competing with them in these programs. So what we did is we worked out an agreement with Opportunity Inc. to take the WASA ADS, Adult Day Services program, the group homes, which we have 3 group homes. One was in the process of being closed. So we had those, and then we had the supportive apartments. So we transitioned those over. The transition actually happened today. So what I tried to do was work out a deal with Opportunity Inc. that allowed for the clients to receive the services that they're receiving now so that we would not see a disruption in services for the clients. Tried to work out a deal for the employees because I want to try to take care of our employees as much as possible with that also. And as we did that, Opportunity Inc. offered that best ability to do that. So they took all the clients and then they offered all the employees positions. So to help with that, because we are self-funded with health insurance, we did help the employees out with keeping them on our health insurance until January 1st if they accepted a job with Opportunity Inc. And then that helped in that transition because Opportunity Inc. could not put them on their health insurance until the 1st. So we are doing COBRA for those employees for those 2 months. So I just wanted to give you an update. I know that this had hit the news and everything, but you're our oversight committee also, and I wanted to give that to you. Now, the key with this is Opportunity Inc. specializes in these programs, and that, as I've been working with them, especially over the last month, it's easy to see how they specialize in them. And for us, we couldn't specialize in them the way that they did. We had gotten out of many of these programs over the last few years and just had a few left. This allows us now to specialize in what we do best, and they can specialize in what they do best, and all the clients get served. So I'll answer any questions anyone has.
Are there any questions? Supervisor Krause?
Thank you, Chair. I just want to have a question for clarification. The transferring of these programs to Opportunity Inc. is the adult day services, the 3 group homes, and supportive apartments.
Correct.
Thank you.
Any other questions?
Madam Chair, can I add?
Administrator Leonard?
Thank you, Madam Chair. Just to add one other thing, if you watch the HR Finance and Property Committee meeting from a week ago, or it feels like a week ago. So one of the things that when Gary initially approached Marathon County, and we had a discussion about this at the Executive Committee for North Central Healthcare, Marathon County actually owns a number of those group homes. 2 of them, in which North Central has delivered those services. So like Gary said, he was looking to the opportunity to essentially find another service provider, a different delivery model, as opposed to, in my mind, I look at things like, hey, if we have a service we deliver, do we do it directly or do we contract? Well, Gary was putting together those agreements to have Opportunity Inc. take on the responsibility of delivering those services. The where, in terms of where those services are delivered, at least with respect to 2 of the group homes, those were owned by Marathon County, used by North Central. When Gary started looking into his ability to assign those leases, he learned that leases, despite the intent to have them completed in 1997 or 1999, in that time frame, they were never done. So I went to HR Finance after Gary sat down and we talked about it to rectify that issue, and we did sign those leases. I think that was last week or earlier this week. One of the 2. But the kind of the legal progression that Gary went through is I just wanted to kind of bolster what he said. It's this, how do we find a way to ensure that the services continue, that the locations that the county has owned for a specific purpose continue to be used for that purpose. So within those agreements, if at any point Opportunity Inc. says, hey, we don't want to use these group homes for group homes, we want to do something else, well, they can't. They can't rent them out to you or I. These are the services that are to be delivered in these locations. Opportunity Inc. is, for lack of a better analogy, there's a contract, a memorandum of an agreement to call for Opportunity Inc. to be the service provider, where North Central has. And as Gary said, I wasn't here when Family Care came in and the transition was made to managed care organizations, but for whatever reason, North Central Healthcare Marathon County, through North Central Healthcare is probably the best way to say it, stayed in this business despite that other counties hadn't. This is really, like Gary said, it's transitioning in a way that other counties had while still ensuring that those services that are needed, I mean, make no mistake, CBRF services, community-based residential facilities, group homes are needed. Quite honestly, I'm sure the managed care organizations would tell you there's more need than availability, but it's not a space where counties are mandated to work. It's a place where we have in this county, but there are others that that's their specialty. So just wanted to add that additional kind of legal framework around the leases and that progression. But happy to volunteer Gary to answer any questions you might have.
Thank you. Supervisor Marash.
Thank you. Just for clarification, so last year when Community Corner Clubhouse closed, Adult Day Services moved into that facility, correct? So is Opportunity Inc. taking that over?
Nope, and that's a very good point, because that's another thing that I can tell you, because per the so Opportunity Inc. moved all of the Adult Day Services, ADS services, to their facilities. So they're using their facilities. They are not using that building. Per the Tri-County agreement, North Central Healthcare is not supposed to own property. Now, we do own 2 pieces of property. This was all before I got here. We have a vacant lot that was donated to us that we demolished the building, and it's just a vacant lot that can be sold. And that it's 811 North 3rd Street, I believe, is the address for 3rd Ave. 3rd Ave, thank you. So what Executive Committee did at their meeting on Monday was also approve for us to transfer those properties to the county. So we are in the process of doing the paperwork to transfer those properties to the county for the county to sell. And we're asking because North Central Healthcare either purchased the property or spent the money to clear the property on where it's at now. We're asking that the money that the county makes off of that go towards the debt. So that is, we did do that, and now I'll be working with our legal counsel to do all the documents to get those transferred over to the county, so that then we're in compliance with the Tri-County agreement. So thank you. That was a very good point. So that's another thing that we're trying to get everything in line the way it's supposed to be.
Thank you.
So where are they now then? I'm sorry to interrupt. Where is Adult Day Services located?
I believe that they're on River Drive down there, and their
old
building
VFW?
down there.
Correct. The old VFW, if you're familiar, was transferred to Opportunity Inc. And they actually made a lot of improvements in that building to have, and it's quite honestly, it's a thing that's nicer than at the location on 3rd Ave, the drive up, to allow for clients to have ingress and egress out of the buses. They spent a lot of resources to get that updated, but that's the building that they're going to be operating out of.
Well, I was just going to add, because you brought up a very good point. If we would have continued with Adult Day Services in that building, we would have needed to have done quite a bit of work because of the wheelchair accessibility and different things that we would have needed. The building really wasn't sufficient for that. So,
Thank you.
Supervisor Krause.
Thank you, Chair. I have a question, and that is, I know you have like an Alzheimer's dementia unit. That is not being affected by this, or is it?
no, you're talking about the nursing home?
Doesn't North Central Healthcare have like activities, group activities and things like that for people with Alzheimer's?
That happens at the nursing home. That is not at Adult Day Services.
Okay.
So that's under the nursing home.
Okay. And I know in the group homes that there's employees there 24 hours. They either live there or they come in and out. So is this a cost-saving measure? Is that why you're getting out of the group home business?
Yes.
Thank you.
Okay.
Thank you. Any other questions? Supervisor Marash.
Since it's a cost-saving initiative, what are the cost savings? Do you know?
Well, okay, off of our last financials, and I'm going to give you a round number on this because I don't have them right in front of me, but they are roughly $250,000 in the negative right now. So it is a cost-saving measure.
Thank you. Supervisor Marshall.
Are there any other services that North Central Healthcare does currently that are non-mandated services that are losing money?
Well, I think that's a loaded question. So outside of the community programs that we do, the only one that losing, now off the top of my head, losing money, no. Now, when it comes to the community programs items that we run, of course, we're always looking at those. The youth hospital has not made money, so that one is one that has ran in the red. So there are some others, but we're looking at that now because now the whole purpose of this, and we had, in order to make our budget, we had removed these programs, I want to let you know, because to make our budget, we needed to remove the losses. We couldn't make our budget with these losses. So we had removed these programs. Now we are really concentrating on the programs that we have to do. And then those that we don't have to do, we're also looking at all those so that we can talk to the counties about them.
Thank you.
Yeah, Hope House is one that is in the negative, and we had asked for some extra funds, if you remember, in the budget on that one. But yeah, there's off the top of my head, I don't have all of them, but we started a group to start looking at that now because we're really diving into the financials. We have, I have to say, we have one of the best finance people with Jason Hake. He knows these programs and understands them. So that's coming from a person that was in his position, that we have a great person that's working on this to help us. So we're in the process.
Just one follow-up. So with the aquatic therapy program, it requires a doctor's note to actually use it. So you're really restricting your revenue by turning people away unless they have that referral. Have you considered opening it up to the rest of the community because I know people pay to achieve or, to use the pool. So you're limiting your revenue source by requiring a doctor's referral.
Yeah, I would have to look into that a little bit more. I know that there's different things that we're looking at, and I would have to look at the reasons behind all that. I haven't dug that deep into the pool yet and how many PTs we have, because finding the employees to do some of the stuff makes it.
My question is for those that are doing community swim on their own.
Oh, community swim.
Yeah.
Yeah, we haven't opened it up to that. That I would have to look into that. So,
Like I said, that severely limits your revenue. Thank you.
okay.
Thank you. No, okay. I'm wondering if the committee is okay with asking John Robinson to speak to 6C. Everybody okay with that?
Which is the budget?
It is.
Sorry, I'm transitioning from broadband to this meeting. We're just, again, as part of the ongoing process to try to engage and involve the committees in trying to set the budget and budget priorities, we are inviting participation and comments relative to the areas of jurisdiction, for lack of a better term. If you have things within social services and health and others relative to budget amendments or changes We continue to encourage you to get those forward, put those forward, and we look forward to do it. I would like to just address an issue that came out of here relative to the Social Improvement Fund. You had requested that the committee look at the allocation of the Social Improvement Fund dollars for in applying that for a number of things, but in essence reducing the debt service in the budget. And I think the committee did not act on that resolution, deferring to the current policy, which says that fund balances should go into the capital improvement program, or excuse me, the money that is not put into reserve should go into the capital improvement program. And I think we'll be in a position to talk about that next week. But the concern is that our capital improvement program funding has been going down. We only had $2.8 million this year. We had $10+ million of ARPA funds that we committed to capital improvement. And if we start taking money that would otherwise roll over into the capital improvement project going forward, we won't be able to support projects. And we had increased, for instance, the rolling stock, the amount of money dedicated to rolling stock for our highway sheriffs and other departments significantly, because we hadn't increased those rates in 13 years, and we're going to have more demands on capital improvement projects in the future. So while the county board is the ultimate arbitrator, there were some reasons for the committee not taking or not. We considered your request, which was the ask, and we didn't approve it yet, and there's still the opportunity for us to do that on the 8th.
Thank you. Are there any questions? Supervisor Cavelli.
Thank you, Madam Chair. So I was reading over Supervisor Baker's amendment that talks about the Social Improvement Fund. And from my understanding, initially when we first passed that on to Health and Human Services Committee, that there was a fund of about $14 million in that fund. Is that correct? And then I know that we talked about the reserve and allowing social services to have that reserve in case something came up that they needed it for. Has there ever been a time in recent history where we had to dive into that fund, and if so, how much?
I'll do my best. As part of our budget building, and I believe it was either 2018 or 2019, we actually transferred from the general fund to increase social services positions and increase the allocation for placements. I don't know that we've ever dipped into the social improvement fund, and the analysis that Finance Director Palmer did on that 14 million, and I think we still need to do some work to really refine that, was of the 14 million, they went back, I believe, to 20, was it just 6 years or 8 years they went back? And I want to say they identified $6 million of $6.5 million, thank you, of funds that would be kind of available in a truly unrestricted fashion, because a lot of the dollars that go into that are dollars for specific purposes. So that further analysis needs to happen, but in terms of transferring out of that fund beyond what was transferred into that fund in any calendar year for purposes of placements, I don't think we've ever gone above that. I know that was probably a complex and poorly worded, but I think that's fair to say that fund, what would go, we looked at things in a very yearly centric way. I do think there's certainly an opportunity to sit down with North Central. I think this is my interpretation of the proposed amendment, identifying the excess and coming up with a plan to how to use that excess to make sure that if there's a shortfall on North Central's ability to service the debt that is laid out in that debt service plan that, quite honestly, I put together. So it's not like it's anything, it wasn't based on some in-depth financial analysis by Gary and I. We just knew that North Central couldn't make the debt service payment last year. And as part of your budget last year, you directed me to sit down and work with North Central to come up with a revised plan. Well, we revised it as within the timeframes that you allotted and pushed that debt later. But a true financial analysis of, hey, how much can they service? I think we'd benefit from doing that and then stretching out to use that social improvement fund, as I understand Supervisor Baker's intent. I think that's a really good idea to have that analysis and allocate enough of that to set it aside. I don't know that the excess is enough to do that throughout the life of that borrowing, however. So, but we'd have to sit down and do that.
Thank you for that. And a follow-up, if this is going to be part of the budget year over year to make sure that that fund has a balance that's available to use, are we looking at it correctly on the amount that is needed in that fund to be able to cover any services that we need to provide?
Well, the services, let me start with this. What goes into that fund, and Christy will probably correct me when she watches this video, but all of your levy goes into that fund to perform the work of social services. What makes it different than the other departments is that is where those excesses have lived, and historically we would scrape those going back to pre-2018, those were scraped, and that's why that was flat. So that has grown. Absolutely, the amount of money allocated to social services needs to be sufficient to fund its operations, or you have a situation like has happened in other counties, I know this to be the case, when there's a shortfall, and we've done this for other departments in the county. If there's a shortfall, you come in the middle of the year and you ask for a transfer from the general fund. So we don't want to do that. That's what that social improvement fund is for. Going back, I do think that analysis and saying how much is in there that can be freed up for debt service would be very valuable. As Chair Robinson referenced, you do have a controlling policy right now that essentially if there's an excess, it would be transferred into the general fund, and then in the year following the audit, it would roll into fund CIP. Because this is kind of like, again, I'm a big analogy guy, it's like putting on your suit jacket or your pair of pants and you reach in your pocket and you found money you didn't know was there. It's a good thing. And you have this kind of challenge that, for lack of a better term, that exists, which is how do we service the debt that under our original master plan and financials that were, projections that were made pre-pandemic, North Central was going to be able to service that debt. That doesn't look to be, I don't think anyone is saying, hey, that's absolutely still the case. So there's some question there. Taking advantage of that and setting up a plan, a debt service fund, I think is a very conservative and prudent approach. I know Supervisor Marshall had a similar thought with respect to, and I don't know if I saw you had a revised resolution, but taking any proceeds from, like Gary referenced, the sale of the property on 3rd Ave and the vacant lot, if we use a similar approach with when we vacate properties on River Drive to set that in that fund, certainly that's entirely up to the board. But I do think it sets aside funds for a purpose that you're protecting against a risk, right? That's what this would be. You'd be mitigating risk by setting up an account from which to draw upon should North Central not be in a position to service its debt. I think makes prudent sense. That's entirely a board discussion, but certainly some of those funds from the Social Improvement Fund could be set aside for that purpose. And I know that's one of the things that HR Finance is going to be talking about.
Supervisor Robinson.
Let me just go through again what we do with fund balance. So we've been budgeting tighter and tighter every year, and to the point where we anticipate vacancies in the Highway Department and Sheriff's Department, which has reduced our fund balance. But the fund balance from 2022 is applied to the capital improvement program in 2024. In essence, the more you have in fund balance that rolls into KIP, the less you need to borrow in the future. And so you can argue that you can apply it to debt service or you can apply it to debt avoidance. But we have ongoing capital needs, and I think one of the concerns that I have, having been on the board for almost going on 18 years, is that we need to make sure that we protect ourselves going forward in those investments. And we really worked this year on rolling stock because we hadn't kept pace with inflation and we hadn't replaced the vehicles, and we're playing some catch up. And you put 35% of the capital program into IT and licenses and other things, and all of a sudden there's no money left. And so if you let the social improvement fund, and I think there are a variety of reasons why that balance grew, but our policy says roll it into the KIP. I would hope that we would do that just to protect for debt avoidance in the future. So I think we're trying to get at the same goal, as to reduce the reliance on debt. The question is whether you do it through funneling the excess proceeds into that KIP to avoid borrowing in the future, or you use it for debt service. And our current policy says put it into the KIP.
Sure, thank you for that, and I appreciate the clarification. I'm still trying to digest the resolution, and then still be responsible to the taxpayers, right? That's our ultimate goal, is to be responsible with the tax levy, right? So, I think the resolution makes a lot of sense, but I appreciate getting it rolled over so we don't incur debt in the future. So, thank you for that.
Supervisor Krause?
Thank you, Chair. I realize that we have, I think it's a AAA or AA rating, which is really excellent for the county. We haven't had basically money problems that has brought down our credit ratings. About this social improvement fund, I'm not very familiar with it, but what I was wondering was, can any of that money possibly be used for expanding child care in social services, or putting in a child care center for the employees of Marathon County, including North Central Healthcare?
The short answer is yes, a portion. That's to Supervisor Covelli's question earlier, and my response about the analysis that we've done, that a portion of that funding would be unrestricted in a sense that you could use it for anything. But your current policy, as Chair Robinson references, that at the end of the day, any amount above what should be in that fund will be, absent action by the board to change it, transferred into the CIP next year. But those dollars, the portion that are, again, for lack of a better term, unrestricted, you can use for any legal purpose under Chapter 59 that you're able to allocate funds for.
Supervisor Marshall?
Thank you, Madam Chair. One of the questions I had is that we're into November, and it would appear based on this year's financials that we are going to have excess social services fund that will add to the social improvement fund. Has anybody done the forecast to say what is that excess going to be? I know that if it's even half of what it was last year, that could be the $1.5 million that it could match the $1.5 million that Supervisor Baker is suggesting be used to reduce the debt levy.
Short answer, no. We generally don't forecast out. We have a fair amount of bills, and social services is no different. In fact, it's probably more the case that a number of their reimbursements or the funds are expended in the following year. So we haven't forecasted out. That's kind of really the point of the audit, is to go back and figure out what really were the end of year balances and then do that general fund calculation. Moving forward, I think, as I interpret the question, would it be helpful to really fine tune that budget and go back and have that look and then have a spending plan. Do you want a deficit spend out of social improvement for social services, or do you want to have it go into capital, or do you want to have it go into debt service or debt avoidance? Those are all policy questions for the board. I mean, financially, you can do either one. Or either
My
one.
question is, this year, we're into November, we must have a fairly good idea if we're spending, if our rate of spending is going to result in a deficit or an excess for 2023.
I'll allow Krista. I don't have that up in front of me.
Yeah, there's a lot of different pieces to that, but I would say in general, the short answer is, if you think about out-of-home placements, we are under what we budgeted for in 22 for 23. So we should have an excess, at least in out-of-home placements, going into 24. That's really all I can speak to. Do we have an excess, right, like around personnel? Maybe because of some vacancies, but those are the things that are going to be harder to talk about. There might be some contracts that are underspent, but those haven't been moved around yet. But I would say overall in out-of-home placements, we are under what we projected to be, so we should have an excess, at least in that area. Of what amount at this point, I can't tell you, but I could do a little digging and bring something back for you, at least a ballpark, if that would be advisable by this board.
That would be very helpful. Thank you.
You're welcome.
Any other questions? Okay, moving on. We're down to number 8, next meeting, date and time, announcements, and future agenda items. A, committee members are asked to bring ideas for future discussion, and our next meeting is December 6th, 2023 at 3 p.m. Do I have a move for adjournment? Okay, Supervisor Covelli with the motion to adjourn, and second by Supervisor Krause. All those in favor? Say aye. Aye.
Aye.
Opposed? Okay. Have a great day.